There we go.
Says it's recording.
Yeah, now it is. Okay, let's go to the next page. And because of Don's story on the wall today and knowing how each of us have been affected in some way, I have made tonight's meeting about the history of doctors. And we're going to end it, of course, with our lesson in putting a little more happiness into your life. So our statements, our unfinished statements tonight, the last time a doctor talked to me about nutrition is, at the hands of a doctor, I was mistreated when. My favorite doctor was, because, and then our standard, what I am most grateful for today and what I most want to share tonight is. And the reason I have WebMD down there, how many people attended the Zoom last week for the Sundown Challenge?
Yeah.
I really, every time somebody else is introduced to me that is just a health coach, and if you take these chiropractors, heart surgeons, and all these doctors that have become health coaches, and Dorothy and Marcia both have been in the presence of them, and they will all say they don't want their degree put on their tombstone. They want to put that they were a certified health coach with Optavia. And so when the doctor on that call the other night, he was the medical director for WebMD.
Yeah.
Is that wild? I love when I see somebody like that that's getting on the same mission we are. I mean, it makes you really feel like you know you're in the right place.
Right, yeah.
So I will start off this with, at the hands of a doctor, I was mistreated when. And that actually came back when we were doing the videos, as we were doing different elements of the story. I remember about being in a car wreck when I was 38, and I had a back injury, and the doctor wanted to do trigger point injections on me. Tony was I was put in Tony's care because the medicine they would give me would let me stay awake so they could ask me questions, but it would induce amnesia, so I wouldn't remember the pain that I would experience. Now, Tony and we didn't get enough instruction when this happened. And so this is the time when I started putting on weight. And then after about 50 pounds, I said, I'm sitting there complaining about putting on all this weight. And Tony says, well, you should with all the food you eat. And I said, what do you mean all the food I eat? He said, well, as soon as we leave the doctor's office, you want to stop and eat. And before we get home, you want to stop and, well, I have amnesia. This is the part where he's supposed to be looking out for me. The medication also induces appetite. And then at my last visit to the doctor, his wife said to me to not come back again.
Jeez.
His wife told me, do not come back again.
Whoa.
Why?
Well, because the treatment that he was giving me was causing me all my problems.
Oh my gosh.
Yes, so that is the last time I was mistreated by a doctor. They gave me a pill that when I went to refill it at my doctor's, he asked me what was I taking this for. And the reason that doctor had prescribed me that pill was because of the weight gain I was experiencing. And the pharmacist says, if you're not dying from something, this will kill you.
Oh my gosh.
So that was my last time back to that doctor. Horrible experience for me, and it's exactly where my weight gain started and a lot of my medical troubles began, and I've been overcoming them ever since. So Don, I totally identify with your story today. Who would like to go next?
John, are you going to tell yours?
What, the one? Go ahead.
No, you go ahead.
I guess I was going to talk about the one that in December, after I came home from the hospital, from the cellulitis and the sepsis, and I wasn't getting any better, and matter of fact, I was getting worse. So I went back to our brand new family doctor, and it wasn't the doctor itself, but the PA or the physician's assistant. is who I saw because the doctor was out of town for Christmas. And I'm sitting in the chair in the examining room, and I'm laying in the sink because I can't sit up. And Sue had to actually, I think I walked in with a walker. When I left, she had to wheel me out on the walker. And PA took my blood pressure until it was 60/40, which they should have called the ambulance, but they didn't. And she told me I was dehydrated and to go home and drink water. And that night, Sue called the life squad for me at midnight because I was almost bled out totally.
Jesus.
And I got to the emergency room, and first thing I heard him say was, "Get us an emergency unit of blood." And 7 days later, Sue, and 6 units of blood and a unit of plasma later, I came home.
You had, tell them why.
They told the emergency room doctor told me that if Sue hadn't called the squad, I'd have been dead in the morning.
Jeez.
He had 2 bleeding ulcers.
Oh my gosh.
Thank you, John.
Yep.
Next.
Okay, I'm gonna go.
Go ahead, Kathy.
Can I change? Do I have to go on this, talk about the same thing y'all are talking about, or can
Not
I?
at all. You can talk about anything you want to.
I'm gonna go to my favorite doctor, and the reason being is his name is Brian Roy, and he's young, and it's not that he's young. That's not why he's a favorite doctor. But what I like about him is that he comes into the room, he sits there and listens to me. He doesn't just like do nothing, but he listens. You know, and it's not that we just talk about, you know, oh, my aches and pains or whatever, but he's very attentive, you know, and you know, about what's going on. He works with all aspects. You know, he wants to be that kind of, you know, person that overlooks my health, and he very into, he knows I'm a vegetarian. He knows that I don't want to take a whole lot of garbage, because I won't, and I will fight him tooth and nail on it. But he like comes up with options for me, you know, and instead of just going, well, you need this prescription and this and this and this and this, you know, he doesn't do that. He like listens to the way I want to take care of myself, you know. And so I'm really, really happy with him.
Is he a family practice physician?
He's actually
Internal medicine?
He's what is it? What is it when they're not a doctor? What is the guy right up underneath them?
Physician
Physician's assistant?
Yes.
PA. And
yes, and but he's great.
But don't you think, Kathy, it makes a difference when you know how to advocate for yourself?
Absolutely. Well,
Yeah.
I am that person, though. I am that. I will fight to the end for myself and for anybody I love.
And I'll throw out Dr. Hanley there. I had him for 30 years, and I love Dr. Hanley. And the only reason I don't go to him now is my insurance doesn't cover him. So we do know there are doctors that care about you. Huh?
That's terrible that your insurance company did that.
Well, I think Dr. Hanley picked not to use that insurance company. So
Yeah.
it's fine. I'm okay because I advocate for myself. So I know how to do that. Right. Who's next? Thank you, Kathy.
I'll go.
Okay.
I can so relate to Dom's post this morning and all these stories about being mistreated. So at the hands of doctors, I was mistreated repeatedly over and over again. And a doctor has never asked me about nutrition. And I've seen a lot of them. And it's so important when you say advocating for yourself. In my case, it was a mental health. It was bipolar disorder. And I did reach a point where I was cognizant enough and had educated myself enough to advocate for myself. And for so many years, there was no advocating, because sadly, when you have a mental health diagnosis, they don't see it as even the professionals, in my opinion, didn't treat me as a patient. They treated me as someone with something wrong with,
A condition.
diagnosed. If I had to say it, mentally retarded, someone who had a lobotomy, like someone who didn't have a piece of brain, and I had a brain, so it was a very horrible experience. So that makes me even more grateful for where I'm at now, and the fact that nutrition, has done what it's done for me.
And Lisa, I posted a picture of when we went to Tennessee at convention because it says 4 years ago. We always, when we're talking about your story, we always talk about it like it started when you got on Medifast. But
No.
it really started 4 years ago. So this has been a 4-year journey. So when I saw that, that made me realize that. That's when it all started. And that's why I posted it. It was in honor of you.
Yep, it was when you were coming back from a convention when you were at my house and you shared with me, and that changed my life.
In Tennessee. Yep.
Yes.
Amen.
Yeah. Who's next? Thank you, Lisa.
I'll go, Connie. Many, it was way back in the 70s that a doctor mistreated me. I had multi-miscarriages after having my son, and our one doctor sent me to a clinic to try to find out why I was not carrying them. And one of them in there that had never seen me, he come in the room and he said to me, it was like no history or anything, or I don't even know if he looked at my chart, but he said, do you have problems with your parents, and especially your mother? And he put down this line, and I'm trying to, I'm just saying, what has this got to do? Well, at the very end, he said, well, some people don't really want children. So, it was like I was causing me to have the miscarriages. Well, I went home and I was hysterical. That which leads me to my favorite doctor, who was Dr. Gorman, who had sent me there. And when I went in to see him, because I called him and I said, I want to quit everything. And he talked to me, and he said, if I had thought you needed a psychiatrist, I would have sent you to one. And he says, believe me, that man will never come near you again. And it just, and they determine that they think that, how like when you have the measles, you build up and so that you don't ever get them again. Yeah. They think that after I had Gordon, that's what happened, and that's why Dick and I ended up having Colleen, because it was it was like the measles I wouldn't get again, but chicken pox or something else I might. So, and that's what they finally ended up determining.
Here it is all these years later, and you're still marred by that. So interesting.
Well, it just goes to show you that sometimes you have to advocate for yourself. But I was young. Yeah. I was only in my 20s and stuff, and I hadn't gone to nursing school and did not realize that, your doctor said to jump, you jumped. You didn't ask them why or. Yeah. Now I think, thank God, I think people are beginning to realize they have rights. Yeah. And that we did a thing on that one time, didn't we, Connie?
Yes, we did.
On the rights of patients, that so many patients won't question or whatever.
Thank you, Marcia. Yep. Dick, do you want to go ahead and go now?
Well, yeah, I got a dialysis doctor that's very, very good with me. And fortunately, I'm going to go see him tomorrow and see what's going on with me. Hopefully, it's doing better.
We all need our doctors, don't we? And the better they are, the more it helps us. Who's next? Thank you, Dick.
I'll go next.
Okay, go ahead.
I've got a story like hers. I had an IUD, and I got pregnant because it got lodged in my uterus. And I was very, very, very ill during the whole pregnancy, vomiting, losing a lot of weight, very sick. And my doctor, his wife had 8 children and had never had morning sickness. So I went in to see him, I went in to see him. Now he tried to remove the IUD. It was embedded in my uterus, and I didn't even know that I could still get pregnant. So that's how stupid I was. Anyway, so I went in to see him. I had 5 intravenous feedings at the hospital, and he says, you know, there's a terminology for what's happening to you. He said, and it's caused because you don't want your baby and you're trying to puke it up.
Oh,
Oh my God, just like Martha.
Yeah. He said there's a real medical terminology for it. Anyway,
Well, that was medicine back then, right?
Yeah, right. That was
got
Thank you, Dorothy. That was good. Who's next?
I'll go if nobody else is going to go.
Yeah, go ahead, Dawn. Tony, you're muted.
The last time a doctor talked to me about nutrition, I initiated the conversation. But before that, the only other doctor that ever did was my brother. My favorite doctor is my brother. He's probably one of the best doctors I've ever met in my life. He's a chiropractor, but he's so smart. He can diagnose things that some medical doctors can't. I'm grateful to be up alive today. At the hands of doctors, I was mistreated when I have more times than I can possibly think of to say I've been mistreated more times and should have sued more times than not. From dentists that took out my wisdom teeth that didn't read my chart, that I had a bleeding ulcer and gave me medicine I wasn't supposed to have, and I ended up in the hospital, to I was so sick after a hernia operation, and my mother had to go to the doctors with me, and I was 40 years old because my doctor wouldn't give me medicine, and I actually had an E. coli infection.
Oh, man.
And I was lucky to be alive because she let me suffer for 6 months with an E. coli infection and kept telling me that she wouldn't give me medicine. My mom, first time I can remember her actually getting in somebody's face was in that doctor's office where she said, "You will give my daughter pain medicine," and that's the end of that. And that's the first time I can remember her doing that. But they nicked my bowel during a surgery and left me, didn't tell me, didn't do anything about it. The surgery that has me disabled, you know, and a lot of stuff, everybody's laughing at the after the fact of how these things have all happened. But honestly, and I don't normally talk like this, but it pisses me off beyond comprehension that a group as small as ours can have that many of us have so many incidents of where we've been mistreated or misdiagnosed or not treated with respect and dignity like we deserve. And it's not the way it's supposed to be. And it infuriates me. My whole experience yesterday, the more I go over in my head the things that this guy said to me, the madder and madder I get. I'm having to do breathing exercises to try to make myself be calm because my head's about to explode. My blood pressure is through the roof. And the fact that the dirty looks that he gave me and the things that he said to me, one of the questions he asked me is, well, what do you do for a living? I said, right now or before? He said, well, right now. I said, I'm disabled. He said, well, what did you do before? I said, I was a clinical massage therapist contemplating going to school to be a holistic doctor. He just kind of rolled his eyes at me and said, well, I'm going to do blood work and stuff and check your cholesterol. I'm like, what?
God.
And I was like, my cholesterol that a year ago when my blood work came back great, my cholesterol was 165. Okay, I'm fat. End of story. I know I'm overweight, but I was way overweight before. And he never asked me what I eat. He tried to imply because I have more than one bowel movement a day that there's something wrong with me. And I just said to him, we're going to have to agree to disagree on that because I know that that's not fair. He said, normal people only have one bowel movement every day or two. And so at that point, I was losing respect for this guy. But yeah, my mom could probably think of several other times where I was messed up by doctors. It was kind of like not.
I can think of one, the most outstanding one is at our hospital, the 10th time or the 9th time you went there.
Oh, okay.
Laid there for 7 hours, gasping for breath, and they didn't do anything. And when he came into the room and he put his elbow down on the table and he said, if you were so sick, why didn't you come by ambulance? I live 5 minutes from here. And for 7 hours, she's gasping for breath before they transferred her to another hospital. But that was the ninth time. Yeah.
That was on November 15th, 2011. And at that point, this is one of the things I told the doctor yesterday. I'm so tired of being treated like a drug addict and like I'm drug seeking because I had my mom, my brother, who was a doctor, his child, my son, and one of his friends were all in the room with me as I'm struggling. I was fighting with everything I had to get in air. And he would not until my brother said, then you sign her out. But I tell you what, if anything happens to her, I'm going to own this effing hospital. And there had been an ambulance waiting to take me for a couple of hours to take me to another hospital. And this doctor was just a jerk. And he would not let me go. So he shipped me in the ambulance with no oxygen. We get on the road and the paramedic in the ambulance is freaking out on the radio with, was it St. Mary's I went to, Mom?
What's that?
Was it St. Mary's in Bay City that I went to?
Covenant. Bay City.
Okay. Bay City. They're calling their ER and said, she must be falling asleep because her oxygen level's dropping like crazy. And I said with my last breath, I'm not falling asleep. I can't fight anymore. I need you to give me oxygen. They gave me oxygen. They sent me to a new ER, and I wasn't in that ER for 5 minutes. And there was a doctor there that scoped me and told them, you better give her the medicine she said she needed right now. And if she ever comes back here again, don't question her. You give it to her.
The problem is there's nothing written in the medical book about her condition.
Yeah. Thank you, Dawn. And I'm glad you shared that with us. And everything she's going through is through a medical procedure mistake. So I knew that whenever I made this the subject tonight. And I love that there's always the good doctor and the bad doctor. We can't do without our good doctors and our good scientists. They have our life. Tony,
Amen.
I unmuted you, Tony. You want to go ahead?
Oh, yeah. Well, I almost want to share to unite with everybody because everybody looks at Connie and she's so up to everything. She's the worst person to treat. I'm telling you. The worst.
That's the there.
Oh my God, she's
terrible.
terrible.
You want to share the most tonight, okay?
Driving me crazy.
I got Cody to meet you again.
I'm telling you. You know what she did today? I tell you. I left the house to go in the back to take care of some. I got a trailer in the back, so I had to go work on it. And then she sits there, come back, and she's sitting on the couch, and she's smiling, and she says, guess what I did? And I says, what? She says, I drove the car across the street. I said, you what? I drove the car. What you did? Why did you do that? You see, she's not supposed to be laying down and rest.
It
You
sounds
know?
like
Pay attention. She's
okay, you're done. I'm going to mute you. I'm
not a good patient.
You're done, and I'm not saying thank you. Sue, you're
Connie,
huh?
Thank you.
Connie, my
Yes.
mom would probably argue with Tony about that because she's been with me through every one of my surgeries except one. And at that time, they stitched a nerve in my incision, and I got dropped off at the end of my bed, and I couldn't move, and I was at home by myself. That's another one. But my mom would fuss at me because number one example I can think of is I had an acromioplasty shoulder surgery. I was in an arm brace. It was done as an outpatient surgery. She took me to surgery. She brought me home. We got home, and I decided to barbecue. And my brother was working on my garage, and I just came out and lit the barbecue and was cooking dinner and stuff. And he's like, "What are you doing?" I said, "I'm making dinner." He said, "How long have you been home from the hospital?" I'm like, "I don't know, 45 minutes or so." And so for me, that's part of how I deal with what I'm going through is I try to just not acknowledge it, I guess. That's how I handle it. But yeah, Mom, I'm not a good patient, am I?
I'll tell you one thing though, you will get more adhesion if you don't take care of yourself because that's a proven fact. So take care of yourself when you have a surgery or you will get more adhesion.
Thank you. I didn't know that. Thank you. See, look at what that came out of this. Tony, be careful with your robe.
Hey, at least he has a robe on.
Yeah. So you're next.
Let's see. I've never had a doctor really sit down and talk about nutrition with me. I mean, about the most I've ever had is the doctor we had in South Carolina kept telling us when we were ready to do something, let him know and he'd help. And I thought, as thinking back on that, I think, well, that was really stupid because you really got to have something to motivate you to do this. And at the time, we were happy with the way we were, but now that we're both on program, I know John's disgusted the last couple weeks about it, but he'll live.
Yeah.
But I feel so good that I've not felt this great in years and years and years. So
yeah.
Where have I heard that before?
Marsha.
Okay, I really don't care much about medical doctors, but my favorite doctor was my psychiatrist, which I was going to when I was in my 20s.
Yeah.
He had an apartment in Queens, and I went up one day for a session, and he wasn't ready, so he has a kitchen there. And I was hungry, so I went into his refrigerator because he let everybody do that. And I was looking for something to eat, and he really didn't have anything. So when my session started, I happened to mention to him, I said, Doc, I was hungry today, and you didn't have anything to really eat. And he looked at me, and he goes, I didn't have any love in my refrigerator.
Oh.
And it just kind of, it just really registered when he said that.
That's cool, yeah.
Yeah, and I never forgot that. I never, ever forgot that.
So now I'm thinking we have everyone. Have I missed anyone? Okay. So the next thing we're going to do is, this is Laura. She's, I don't know why it looks like that, but let's see if it works. She's a physical therapist, isn't she, Dorothy? In Georgia. And this was her 3-minute story.
Hi, I'm Laura Strickland, and I'm an acupuncturist and a massage therapist. And in my professional role, I'm expected to set an example for good health. And I never felt like I set a good enough example because I have been overweight for 30 years. I have been motivated to lose weight. I've lost weight. I've been successful, but it would come back on. And it was bad. just bad. And I would tell my clients, you know, if you lost weight, it would help your problem. But how could they take me seriously if I myself was not following my example? Well, my husband never complained. He always said I was fine, and he wasn't unhappy with my weight. And I guess I use that sometimes as an excuse not to lose weight. But my size was embarrassing for me. And a few years ago, my doctor told me that I had signs of metabolic syndrome. Well, that was a huge wake-up call for me because I do take care of myself. I got body work, I took vitamins, I ate healthy foods, but I guess I didn't do everything I needed to do. So I decided I needed to make a permanent change, and I found Take Shape for Life. Take Shape for Life's program is all about wellness, but for me, the first step was weight loss. So I've lost 80 pounds, and I now have a healthy BMI, but I've learned other habits that help me too. I go to bed at a consistent time, I exercise, I drink a lot of water, and I pace my meals and snacks to give me a good balance of blood sugar. So it's really helped me a lot, and I've been able to keep my weight off now for over 2 years. And now I have a new tool that I can help my clients with. I am a health coach as well now, and I use that in addition to my other skills to help people achieve ultimate health. So that's really what I wanted to be all along, a good example, and now I am, and I'm glad. Thank you.
So, how did it begin and when did it begin? I knew we were going to be talking about doctors tonight, and so I thought that if we would just look back how far we've come and to where we're at today and a little bit about where we're going, that maybe it will make us feel better about how bad things are. So prehistoric doctors, 25,000 BC, the first healers were chronicled in cave paintings in what is now France. The paintings were radiocarbon dated as far back as 27,000 years ago. People used plants for medicinal purposes. This is the first recorded instance of what eventually became into the first medical knowledge base passed down through many tribes. Back then, the person who had the most power was the witch doctor. And with the little humor included here, do you mind if I share your post on my wall? I could not pass that up.
That's cool.
I like that.
Uh-huh. 2000 BC, ancient Egyptian medicine had doctors who specialized in treating particular parts of the body, as well as researching the properties of herbal medicines, kept detailed records of the symptoms and treatments of illnesses, formed some of the first medical textbooks. Believed illness was due to the presence of evil spirits or poison. So we've come a little ways. Prayer or pleasing gifts was the only way to cure the disease. Believed in an afterlife, mummified the bodies of pharaohs and important people. Ancient Egyptians had first pharmacists who prepared prescriptions or ointments, potions, inhalers, and pills by processing plant material used to treat specific illnesses. Used opium, cannabis, and linseed oil. Greek medicine, first to study causes of disease. Research helped eliminate superstition. Sanitary practices were also associated with the spread of disease. Hippocrates, father of medicine, first do no harm. No dissection, only observation, took careful notes of signs and symptoms of disease. Disease was not caused by supernatural forces, and wrote standards of ethics, which is the basis for today's medical ethics, the Hippocratic Oaths. You will exercise your art solely for the cure of your patients, and will give no drug, perform no operation for a criminal purpose, even if solicited far less suggested. 700 to 1500 Arabic medicines refined Hippocrates' theories, and Islamic physicians began to use the regulation of diet, exercise, and prescription of medicinal herbs to treat patients. Large hospitals were involved in training and licensing doctors, and pharmacists in Europe. Medicine was still governed by religion and superstition. Used anesthetics by soaking sponges in narcotic drugs and placing over patients' nose. No, I got a B up there. By the middle of the 9th century, Middle East was practicing in what they call hospitals. Around this time, doctors generally knew about how to use catgut and forceps, plasters, ligature, surgical needles, saws, scalpels, and the ever-calming surgical spoon. Basically, at this point, medicine was more likely to help you than harm you. Hospitals came from Egypt in the 9th century. First medical center was the Aman Ibn Tulun Hospital in Cairo that was founded in 1872. The hospitals shall keep all patients, men and women, until they are completely recovered. All costs are to be borne by the hospital, whether the people come from afar or near, whether they are residents or foreigners, strong or weak, low or high, rich or poor, employed or unemployed, blind or signed, physically or mentally ill, learned or illiterate. There are no conditions of consideration and payment. None is objected to or even indirectly hinted at for non-payment. The entire service is through the magnificence of God, the generous one. That's no longer the case. Medieval Europe and the first medical schools. 12th century England saw the emergence of universities and the first medical schools. At this point, being a doctor depended less on the gospel and pre-existing medical texts and more on applying those texts and others to a doctor's individual experience in the field. The ability to reliably affect a patient's health was still hit or miss. Medieval medicine, the first medical university was founded in the 10th century in Salerno, Italy, where Greek manuscripts written by such physicians as Hippocrates were still studied. In the 19th century, over a few hundred years, doctors came to benefit from the use of developing sciences such as chemistry. Physicians began to access other disciplines to help heal patients. They also began to draw on multiple facets of medicine to cure ailments. Among the goodies at the disposal of the 19th century doctors, knowledge of evolution, psychiatry, the beginning of genetics, and immunology. I know we hear about these things, but these are actually labels. This is when chocolate was medicine. This is when cannabis and morphine and heroin were prescribed on a regular basis to the patients. So it isn't surprising that we talk so much tonight about receiving poor treatment. Sometimes poor treatment was what they thought was the right treatment. And after 1920, physicians no longer needed to ask permission of the church before starting their practice or performing surgery. Finally, reliable prescription drugs and penicillin began to curb sickness before surgery or other last resorts were necessary. Modern surgery was coming of age, and the last lobotomy to treat schizophrenia was done in 1970. The modern doctor, to be sure, the modern medicine is all the things people expect when they visit a hospital, but a modern doctor in the developed world is as much of a superhero or science fiction character as friendly sawbones. The utility belt of tools at a modern doctor's disposal includes surgical lasers, robots, high-powered magnetic imagers, and networked data stream.
Yeah.
The future, robots, remote patients, wireless data feeds. Between technology and scarcity of actual doctors, it's likely that future physicians will see patients any way they can. That could be remotely from the other end of a screen or robot, or as part of an assembly line process. Robot assistants actually do most of the work, with doctors coming in at the last step to confirm the diagnosis or perform the trickiest part of the surgery. Also, medicine will be tailored to each patient's individual genome, administered both by nanoscale and sports stadium apparatus across time zones and even on other worlds. So even as we talk about the way medicine is today, we all have to say, look how far we come, don't we?
Sure.
So now let's stop the recording, and we're going to go into our